This presentation is done by Angelina, Esma, and Osama and is going to break down what Arestin is and how it is used for clients with periodontal disease. To begin, let's talk about what periodontal disease is and dive a little deeper into what each stage presents as. Firstly, periodontal disease is the result of infections and inflammation of the gums and supporting tooth structures. Periodontal disease begins with gingivitis, which is the only reversible stage of this disease and presents itself as puffy, red, swollen, tender gums that tend to bleed easily when brushing or flossing. Untreated gingivitis can progress into the next stage of periodontal disease, which is known as periodontitis. This stage of periodontal disease is where the soft tissues begin to pull away from the supporting tissues of the tooth. This loss of attachment causes the bone that holds the tooth in the mouth to decrease. Untreated periodontitis can lead to advanced perio, which is where the tooth becomes very loose, can drift, or even fall out. One form of periodontal disease therapy is through the use of the antibiotic known as Arestin. Arestin is placed subgingivally after scaling or root planning treatment. Arestin is a cost-friendly and painless dental treatment used for clients with periodontal disease through the use of an antibiotic in the form of a powder. Arestin uses microspheres that help to fight complex bacteria that cause periodontal disease. Arestin is placed a few weeks to months after the initial gum disease treatment of scaling or root planning and is placed in less than 6 pockets throughout the mouth with the depths of 5, 6, or 7 millimeters.
As it mentioned, the Arestin is using microspheres that help to fight complex bacteria that are found to cause periodontal disease. And for the microspheres itself, it contains 1 milligram of antibiotic minocycline hydrochloride powder that travels directly into the infected area of the gingival tissue to be released over the span of up to 14 days. So, how does Arestin work? Arestin works with the moisture found in the oral cavity to break into the polymer base known as hydrolysing, which controls the release of minocycline HCl into the infected areas of the oral cavity to be healing. How to administer Arestin? 6 simple steps. The first 2 steps is to make the cartridge ready. So step number 1, insert Arestin 1 milligram cartridge into the handle and apply slight pressure. Step 2, twist until you feel and hear the cartridge click into place. Now the cartridge is ready to use. Step 3, place cartridge into the pocket parallel to the long axis of the tooth. Do not force the tip to the base of the pocket. Step 4, a probe may be used for tighter pocket to gently retract the tissue to make room for the cartridge. Step 5, gently inject the Arestin powder while withdrawing from the base of the pocket. If there is resistance, withdraw further. Step 6, once completed, retract the thumb ring and remove the cartridge. Discard of the cartridge and sterilize the handle for reuse. The following video will show how administer Arestin and the indications and some important information regarding to the safety.
Periodontitis is a chronic disease that begins with the buildup of unhealthy bacteria that forms within dental biofilm. The most prominent periodontal pathogens are P. gingivalis, T. denticola, and T. fluorescенtia. Some research shows that these bacteria prevent healthy, helpful bacteria from surviving in periodontal pockets, which allows the disease to progress and can cause pocket depths to deepen. Deep-seated bacteria may not be reached by a scaler, which means scaling and root planing alone is not the best option for healing, as it can potentially leave behind harmful bacteria that can recolonize within a couple of days. Because of this, it is recommended to use both scaling or root planing with a locally administered antibiotic like Arestin for effective treatment. Clinical studies have shown that the use of Arestin has shown greater pocket depth reduction. Arestin works by using a microsphere delivery system through the gradual release of a minocycline antibiotic to target infections found in periodontal pockets. Arestin is administered as a powder that is injected into the base of the pocket. Once it mixes with gingival auricular fluid, it begins hydrolyzing, which allows the microspheres to bioadhere. Hydrolyzation allows water-filled channels to move through the microspheres and allows the minocyclines inside to gradually be released into the gingival tissues. These microspheres can remain in the pocket for up to 14 days. After these 14 days, the microspheres bioadhere and leave the tissues with a healthy balance of bacteria and a reduction in the pocket depth.
The following video is showing the administration of Arestin in a clinical case.
For assembly, insert the Arestin cartridge into the syringe. Line up the button to the divot and push until you hear a click. Clean the area with an air-water syringe and use a suction. Remove the cap from the cartridge and gently insert into the periodontal pocket. While dispensing, slowly pull out of the pocket. When the procedure is completed, provide the client with the post-op instructions. When disassembling, pull back on the dispenser handle and pull the cartridge off.
With the post-op instructions of Arestin, within the first week, we recommend the client do not touch the sites with the Arestin placed, no eating hard, crunchy, or sticky foods, and then within 10 days to not use any interdental aids within the areas and contact the dentist if there's any severe pain or reactions. And there's no follow-up procedures, there's just maintain visits and control of periodontal disease. The advantages of Arestin: there's no taste bud alterations, no teeth staining or gingival irritation, no leaking, falling out, or need to return to dentist for removal, reduces pocket depths, and no anesthetic required for treatments. The disadvantages of Arestin are the studies have only been done with patients with chronic periodontitis. It's not suitable for clients sensitive to minocycline or tetracyclines. There's potential for hypersensitivity, potential for anaphylaxis, Stevens-Johnson syndrome, and erythema multiforme. Not suitable for children, pregnant, or nursing women. Within the advances in periodontology, currently there are many antibiotics used within the field, but Arestin is the first painless one that requires no further appointments for the removal of materials after a periodontal procedure. Now, moving on in the future, although there's not much research done in the future direction of Arestin, we feel that there's many new antibiotic type therapies for periodontal disease that may be in the making to provide a pain-free delivery method such as this one. We have found two interesting facts on Arestin when used in an oral maintenance program along with scaling and root planning. Arestin can show reduction of pocket depths in 3 months and overall periodontal maintenance within 9 months. The other interesting fact we found was Arestin is the first locally administered time-released antibiotic that does not cause the client discomfort throughout the periodontal treatments. Thank you for listening to our presentation. We hope you found it helpful within the topic of Arestin.